We've been covering ChatGPT. We've heard about the implications that it's had on our everyday lives now for months. You're covering the intersection of ChatGPT and healthcare. What can you tell us?
So it's early days for ChatGPT in healthcare, but we're starting to see some interesting applications. Among them, there is a publicly traded company called DocsGBT that has just released what they're calling DocsGBT, which is a prompt library to help doctors relieve some of the administrative burdens that they see every day in their practice.
When you hear this first, you're wondering, is this going to cut jobs? What is this going to do for healthcare administrators?
So I think one of the things about healthcare, and you may have experienced this, but the technology can be really outdated. So one of the issues is that a lot of doctors' offices and hospitals are still using fax machines, even though it's 2023. And it's not even, is this going to cut jobs at this point? It's really, can this make things a tiny bit faster so that the administrative staff that already have these jobs maybe can spend a little less time and do their jobs more efficiently?
Can you break it down for us a little further? What exactly is DocsGBT doing?
So DocsGBT is it's based on OpenAI's ChatGPT models, which are what we've been hearing so much about. But so one of the big administrative hurdles for doctors' offices is this relationship with insurance companies, where a doctor could prescribe a medication, and then the insurance company says, no, actually, we want you to try this other one, or we're not going to reimburse that. And so what ends up happening is the doctor has to spend about 20 minutes, maybe more, and write what's called an appeal letter. And so I spoke to a doctor who's practicing in Boston, and Eli Gelfand, and what he said, he's now using ChatGPT to be able to write these letters in around 1 minute. So that's down from 20 minutes. He didn't have specific experience using DocsGBT, but the idea is the same, that you can basically type in a person's diagnosis, type in the medication that the doctor wants to give them, and DocsGBT or ChatGPT can help generate a letter. But what I should say is, whenever you're dealing with healthcare, there are some concerns around security and the privacy of patients' health information. And that is going to be a consideration going forward. And so basically what these doctors are doing that I've spoken to, and what DocsGBT is recommending in DocsGBT, is that you should never include what's called the protected health information, private health information. So that's the person's name, their birth date, anything specific to them. Basically, what you would do is get help writing a letter faster based on general diagnosis, and then enter it into their medical record, and that is this privacy protected environment.
I do want to talk about the privacy component here. Obviously, when it comes to healthcare, HIPAA is crucial. Would using a ChatGPT program like this endanger patient information or data in any way? I know you said they wanted to not use the name, but aside from that, could it endanger the patient's data?
So, I would say I think we're still at early days, and I think this is going to be the biggest hurdle to more widespread adoption of this kind of technology going forward. And that's because there do need to be guardrails in doctors' offices and health systems. At this stage, is it really enough to say, okay, well, you're not going to enter that information in? So my colleague Rashi and I spoke to a privacy and cybersecurity expert who said one of the big issues going forward is that even if you're training these models on anonymized data, the artificial intelligence is so smart, essentially, that it could de-anonymize it, de-identify them. So even if you put in information that is general, it could potentially figure out who that person is. And I think that, not just for healthcare, but this is also going to be one of the big issues going forward, because the way that ChatGPT is trained, or any of these large language models, is they require huge amounts of data that are being input to train these algorithms. And I mean, that's one of the biggest questions going forward is, and especially in healthcare, is how can you use this in a secure and safe way?
We've seen problems with ChatGPT just in everyday use, and OpenAI even admitted that there are still issues when it comes to its moderation and it isn't completely accurate. So, who would be behind fact checking these letters that the doctors are using with ChatGPT?
So that is at the upfront, that's what DocsGBT is saying, that everything at this stage needs to be edited for accuracy. So you cannot just put something in, not read it, and then send it to an insurance company or whoever you're sending it to. And so right now, what they call this when ChatGPT makes up information, it's called hallucination, which is kind of a strange term, since ChatGPT isn't a human and humans actually can hallucinate. But I think really what we heard from investors, from startups in the space, I'll quote one, Morgan Cheatham from Bessemer, where he said it needs to be a crawl, walk, run approach. So there really needs to be a human in the loop in terms of any applications. And then the other thing is I think in healthcare, what our story is about is where this is starting is in back-end administration. So where you could say, the stakes are lower than in being involved in direct patient care.